Good afternoon. My name is Leon Markey, and I'm going to talk to you today about the journal article Analgesia and Other Causes of Amnesia that Mimic Post-Traumatic Amnesia. The authors in this article discussed if analgesia played a role in PTA, post-traumatic amnesia, in non-injured patients. They also examined if there were other contributory factors in these outcomes as well. Patients that have suffered a brain injury are listed as having TBI, which is a traumatic brain injury. In the operating room, there are many variables that can determine the outcome of a successful operating procedure. The role that nurses, scrub techs, PAs, physician assistants, surgeons, and also the anesthesiologists. They all play a role in the operating room, but it's the anesthesiologist that helps to bring you into the comfort through the state of sedation throughout the procedure of the surgery. Um, some of the research methods used can be defined as patients in the working age of 41 that were selected from this orthopedic trauma unit and were classified as TBI or likely to have sustained TBI. 186 patients were approached during the admission process and 63 consented to participate. The demographics of this caseload reported patients with depression, anxiety, and post-traumatic stress disorder. Upon completion of the survey, 47 continued on in the study. The independent variables were used in the study. In phase one of the study, a background history, medical history, psychological evaluations were obtained. In phase two of the study, follow-up interviews discuss mood and psychological evaluations were used during the Rivermead PTA intake of the intake. The information reported in these areas were also depression, anxiety, and psychological trauma, um, but they also were evaluated by using the hospital scale, HDAS, which is the hospital and depression scale, and also the impact of event scale, which is the IESR. The independent variable included age, use of opioids, and reflected that depression wasn't significant in the outcome. The dependent variable included the total opioid amount, uh, the age, surgeries, and anxiety that was pre-existing in the patients. The study design for the study that was used, it was through phone interviews, uh, data of clinical patients was collected post-operative to this data. The results reported were 38% like symptoms, even though they didn't have a traumatic brain injury. Variables that were considered in relation to the amnesia were a combination of received opioids, surgical procedures. This was based on whether the patients reported this information or not. The problem with trying to prove that prior incidents related to amnesia like symptoms, even when the patients hadn't had brain injuries, can prove to be questionable. And the reason for this is patient age, young and old patients, patient prior history, disease in the family, substance abuse such as drugs or alcohol, and a psychological disposition such as depression or anxiety prior to. I don't know if it was necessary onset during this um, for them having amnesia. So these are some of the things that we have to take into account for they may have different clinical results and the outcome of how we looked at the patient. Strength and the weaknesses of the study were that the information provided in the assessment of PTI is fairly accurate, and the strength is that the patients were more likely to have weathered the surgery or come through the surgery. The weakness is, and the assessment that we used for the study was the sample size was small. Muscle mass between male and female is different, as males can probably hold a little bit more anesthetic, I mean, due to the muscle mass, and it's different, the physiology scale of the body too. And also, we needed more diversity in the groups. I mean, I think that cultural wise, race, has a lot to do with it too, as far as, could be African Americans, Anglo Americans, um, Asians, even Hispanics, the physiology of the body is a little bit different. And some things we probably didn't look at either if we were looking at maybe some things that dealt with the climate. And I think that might have something to do with it too. There's some things that we probably could have looked at a little bit more in depth, but due to this information that we have, it's kind of scaled down to next to none. Um, some of the suggestions that we probably could do to utilize um, better research design or methods are proliferate and design better education programs to understand patient pain, develop better curriculum and education for healthcare providers, and grow areas of healthcare where pain management is a little bit more of an expertise. Thank you.